Hello, I'm Dr. Sanjay Khanna and I'm a consultant gastroenterologist at Fortis Hospital, Shalimar Bagh, New Delhi. Today, I will talk about viral hepatitis. Before I start the topic, I'll talk about the World Hepatitis Day, which is celebrated on July 28th every year to mark the birth of Dr. Baruch Bloomer, who identified the hepatitis B virus. And this year's theme for the World Hepatitis Day is "We are not waiting." Viral hepatitis, as the name implies, means inflammation of the liver secondary to infections from viruses which go and particularly attack the liver, like viral hepatitis A, B, C, D and E. And out of these, hepatitis A and E viruses are transmitted through the fecal route or consumption of contaminated food and water intake, and viral hepatitis B, C and D are transmitted through the blood-borne routes. How do we identify these patients? In the early part of the illness, majority of the patients would have a non-specific viral-like illness like low-grade fever, malaise, lethargy, poor oral intake, nausea and vomiting, and some even require admission secondary to poor oral intake and water intake, leading to dehydration. As the illness progresses, some of these patients will go on to develop jaundice, which usually settles down in 2 to 4 week period in majority of these patients. Only a small subset of these patients will go on to develop a severe form of illness, which is also known as acute liver failure, requiring urgent medical attention, and these subset of patients may even require liver transplantation. If not corrected by medical management. How do we protect ourselves? Having good, safe personal hygiene habits, proper hand washing, which should be practiced by all, which usually protect us from hepatitis A and E virus illness, consumption of good and non-infected food and water should be practiced. For hepatitis B, C viruses, one should practice safe sex, non-sharing of needles, razors and brushes should be carried out, and surgical practices should be safe and proper. Blood transfusion practices should be through proper centers which basically screen for these viral illnesses, and all of these would lead to protection of these patients. Finally, very important part is vaccination against hepatitis A and B viruses, which is also incorporated into the National Immunization Program now, and this is very effective to protect us from hepatitis A and B illnesses. We currently do not have vaccination against hepatitis C and E virus. How do we identify based on tests? Very simple tests like doing a liver function test or LFT will pick up presence of jaundice and deranged liver function in these patients. We can also do the INR or blood clotting profile for these patients, which will identify the patient at increased risk for liver illnesses in these patients. Ultrasound is also helpful in some patients and will rule out other serious illnesses which can occur and mimic viral hepatitis. And finally, how do we treat? Very rarely do we need admission for these patients. Majority of these patients can be managed at home, providing them adequate rest. A good normal food intake should be practiced by all. There are basically no restrictions for food and water intake in these patients, and majority would settle down spontaneously over a period of time. Only a very small subset who are not consuming well, are dehydrated, require admission and require IV fluids, and only a very small subset who have acute liver failure like illness will require urgent medical attention and may even require transplantation in a small subset. Who are the patients who are at an increased risk? They are the ones who have decreased immunity, patients who require multiple transfusions like thalassemics, who get surgical procedures done or blood transfusion done at centers who are not practicing good and safe methods for protection against these surgical illnesses or blood transfusion practices. Drug abusers who are sharing needles and syringes or razors are there. And patients who have a poor oral hygiene, poor personal hygiene, and who do not practice personal hygiene like not washing hands properly are also at an increased risk. A special note about pregnant females, though they are not at an increased risk for these illnesses, but usually if they contract hepatitis E virus, can have a serious form of illness in a small subset of these patients. Finally, I'd like to sum up that vaccination is very, very important and protects against a major illness like hepatitis A and B virus illness in majority of these patients. Practice good personal hygiene, proper hand washing, proper food and water intake habits, and proper surgical, blood transfusion and safe sex habits. Avoid needle stick injuries by sharing of needles should be done, and it will lead to protection in majority of these patients. Thank you.